My name is Mijal Schmidt, and I'm a psychoanalyst and a psychologist. I've been working for more than 50 years in the clinical side of things, and it's certainly my passion. And it's been a while since I've been also working with plants, first of all, as an experiential or experimental point of view. One thing led to the other, to the point where I'm today, which is working in integration with psychedelics as well. So I have my private practice, and then I collaborate with other organizations, worldwide organizations. So basically I work with people from all over the world, which is something that fills my heart very much. I get to know people from different cultures, different backgrounds, and different questions in life. So that's very interesting to me. So I would englobe the preparation for educational purposes in two main groups. One is the physical aspect, the other would be the mental, emotional aspect. So in the physical aspect, we would take into account sleep, food, and all the meds that you're taking, or the supplements, or all the medications that you might have been taking. That means that some of these need to be stopped, particularly if they're psychiatric. They need several weeks to stop beforehand, to stop taking them. Some foods are preferred not to take, so that your body is more prepared for the psychedelic, so that you're less toxins, less elements that will interact with the medicines. In the physical aspect, it also deals with, trying as much as possible to deal with stress in better ways, or at least that the previous days of the session are a little bit more calm. And I would leave it there on the physical aspect. Of course, I am missing the sexual aspect to it as well, which you should not have sexual intercourse or any kind of sexual matters around the intake with yourself or with others, or whatever combinations you might have. So that would be the physical aspect, right? To take care of your body and to try to suit it in the best way possible, so that the absorption of the medicine is in the best way possible. The other main aspect would be the mental or the emotional aspect. Some people, I've worked with a lot of people, and some of them tell me but I have to be ready, and so I must not have all these troubles to actually go into the medicines. And that's counterintuitive, because we go into medicines also to work on these things that are not really working, that are not really going well. So it's not like you have to get in a particular mental state for you to be able to work with medicines. But I do think that the preparation in that respect has to do with trying to be as clear as possible about what you're looking for, or what are the things that you have in you. What are the things that bother you? What are your worries? What are stressful events that just happened in your life, or that you're going through at the moment of the intake, so that you know that some of these contents that you will find could be enhanced by the elements that you're going through in your life. It's basically what's going to happen. They will influence your whole session. Some preparation could deal with just being open to receiving and not having particular things to focus on, which that's also an approach that a lot of people like to do, because they just want to see what there is, or they might feel stuck with something but they don't really know. And during the preparation, we don't get to those points because persons might not know, or we couldn't just get into them either because of many reasons. Repression can be one, but also tiredness, or maybe the situation is really hard and that takes time to unfold. I consider they're part of the same continuum. Preparation gets you clarity about what you're going to. Integration helps you understand how the elements that you touched upon during the preparation are linked to the final elements, or the elements that you come with to integration. And I find it particularly important to relate these two aspects, which are bridged by the intake itself. The first thing for me is safetyness. Safetyness has to do with the place, so it's called setting. So setting is it entails different things. So knowing the place, visiting the place, feeling how you move in it, or how you feel it, just intuitively. That's important. Sometimes that's not possible. Knowing what's the background of the place that's offering this, and also knowing who are the people offering, what is their preparation, what is their own background, for how long have they been serving medicines, what is their approach, what are the safety measurements they've put to take care of people. Some people include doctors, some people include people who know how to deal with a crisis, like a huge crisis. I'm particularly fond of the traditional approach. And so in the traditional approach, we find people from cultures, from specific groups that have a long history or a long tradition working with plants. But we can't always get to those places, or I think even we are more in present times. We're doing it more than ever. But so safetyness is an important aspect. It's difficult to know what the quality of the medicine is, but I would try to make sure to know who is providing the medicine. Like, where does it come from? If it's gotten from respectable sources, and if these sources are known. We are encountering a lot of mixing medicines and mixing things that are not necessarily, that they become dangerous sometimes. And so I would be very aware of how many things are mixed into the medicine itself. Some medicines are just very plain and they don't need mixture. Some of them need mixture, like ayahuasca. And so to know what there is in the brew is very important. Sustainable sources are so important to me because at least what we're seeing in Mexico and the north is that a lot of groups have hijacked the toads and make them suffer greatly, but also they're shifting the ways in which this substance is gotten naturally, because there are cycles and these cycles are not being respected. And so that influences not only the quality of the medicine, but also the effects that the medicine will have on people. So I think it's very important to understand that these sources are important even for the outcome of our own experimentation. I would be very sure that they offer integration, or that they're linked to some organization, in this case like Nectara, or there are others that offer support groups or integration sessions so that we can continue working after the session, as the work doesn't end with the session itself or the ceremony. And I would honestly be aware of these new age offerings in a way where I like grounded things. I like grounded things. I don't like these things that appear super shiny, super airy, super cosmic. I think it's amazing that people can experiment with different realms and different ways of thinking and of expressing. But when it comes to medicines, grounding is a very important aspect to them. So I would consider that this transmission of the knowledge and the transmission of what I'm going to encounter in this intake is grounded. That's a tricky question. And a lot of a way in which to respond to this question, a way in which to answer this question would be to experiment, basically, because I wouldn't say that yes, there are medicines that are particular for certain things which have been researched for these particular things. So let's say that MDMA has been used for many years for couples therapy because it helps people open up to the experience. It also reduces the repression and stuckness, which is something that a lot of the psychedelics do. But MDMA would connect you more to this kind of loving flow of life. And so this also helps ease these soft or heavy feelings. And since it opens up the conversation and it opens up communication, then it allows people to, talk more easily. And I don't know, some others might be ketamine, which has been also used for PTSD. I think particularly because these have been not only researched in specific contexts, but provided in regulated settings. And so that helps control the dosage, the quality, the time that people are there, and some of the symptoms that can occur during the intake. And so even though psychedelics are being researched for particular things, like ayahuasca has also been and is being researched for depression, for anxiety, I consider that people need to know what the effects of plants have in them, and that's the best way to understand which is the medicine that suits you the best. So there are medicines that take a long time, and we would see this with Bogaine and with ayahuasca, and you would be there for several hours, and then you need a particular space and this setting and else. And it can be very strong, but the time length gives you a lot of space to navigate the strength of the intake. And the dosage is also very important. So sometimes people work with very small doses, some people work with bigger doses, some people work with several doses along the night, and some people just prefer not to take all of them and only one. And so the effects of these vary from people to people, from person to person. There are, however, people who would like to delve faster and sharper into an experience, and maybe they would choose the toad. And the toad is an explosiveness of emotions and sensations and connection to the universe. And not that the others don't, but I would say that the plants are more connected to nature, would connect to the aspects of nature more easily. But with the toad is a very profound and quick experience, but it is a hard one for a lot of people because it's very strong for some people. So some people are looking for strong experiences and they want to delve into things so that they come out of them quickly, which I wouldn't say that's the purpose of psychedelics. But some people do consider these elements to decide which psychedelic to take. Some people cannot go into certain ceremonies because law regulations or because other aspects. Some people can't be in an intake for 6-8 hours, and so they would choose something that's easier to do. Even rapé is a medicine that works very well for a lot of people. It's a very straightening experience. Tobacco is a strong plant that centers, and it's a masculine energy, and so it sharpens senses. It's not a psychedelic in itself, although some people have experienced certain symptoms resembling psychedelic ones. But I would consider experimenting with some of them to understand which ones, according to your own experiences, to your own characteristics, are best suitable. The potential of psychedelics is that they open up in great lengths our perception. They are capable of changing it, at least for the moment, and then we experience different things when we might just go into the flow and then find that our perception has changed dramatically after. Some of this perception goes back to its place. However, the potential of psychedelics is that to open this perception, and with the neural connection, neurogenesis that they enhance and that they promote, then we are capable of either connecting better certain elements in our lives, connecting certain consequences to the origins that we didn't know of, and that gives us a new understanding of things. Something else is that psychedelics, this is one of the most important, I would consider, particularly when integrating or with psychotherapeutic work after, but this is also risky, right? Because psychedelics, they lift a barrier of repression. What this means is that some of the contents that have been hard for us to know in our lives, we push them to the side from our consciousness to the unconscious. It's not a voluntary process, so that's why we might not even know this. But symptoms happen and that are informing that we have this process going on. Basically, we all repress, some don't, but basically we all have these processes, and it is a protective mechanism for our minds, for our psyche. When we go into psychedelics, this is removed, let's call it this way, and so the elements that were repressed come to the surface. Why is this risky? Some of these elements might be overwhelming. We might have not known anything about them, and so when they come to the surface, we're surprised that they exist even, and we might not know what to do with them. So they might overload our capacity to feel them, think about them, understand them, and then that becomes a challenge, a great challenge. However, when there have been traumatic elements or traumatic experiences in our lives, and we necessarily had this repression process, sometimes it's difficult to access these contents or these causes or these origins of the traumatic experience. And the traumatic experience might remain like in a static mode inside ourselves. That doesn't allow us to move freely in our minds and in our feelings to different areas of life. And so we might feel stuck in different areas and we don't know why. And we don't know how to access that. So what psychedelics have done, which is part of the main research that has been done with them, nowadays the research is going in so many different ways at the same time, but these easing of these hard elements inside and got stuck, and then had made it more difficult for us to move in different directions in our lives, or be more flexible with ourselves, or flexible with others, or flexible within, or to be able to change more rapidly, or to be able to take decisions with much more ease. So all these things, what psychedelics provide is a possibility of, when these elements come to the surface, we're able to see them differently. In a way, psychedelics soften these contents, and then they become less threatening, more accessible to our consciousness. Therefore, we're able to connect them with their causes. We know the consequences, and the bridge in between them is the liberating thing. And when we do this connection, basically, we're able to move on. So sometimes the stuckness is either we don't know the cause, or we don't understand the consequence, or maybe we don't have access to the cause, or maybe the consequence is blurry. So psychedelics bridge these two sides of things, and then we become much flexible, I would say that's the word, and more at ease, with the option to explore these elements and then do something about them. They become less threatening. I think this is a very important part, because when we are stuck in pain, we don't want to go through pain. We want to avoid it. And psychedelics, in a way, they put us in front of pain, or they put us in front of stuckness, or they put us in front of whatever is going on in their lives. So this approach that psychedelics allow us to do, this closeness that they provide with our internal world, is what allows us to take steps to change our current situation. It's hard to say no, because I wouldn't like to tell someone that, no, you didn't go through a horrible experience, because I know that there are experiences that are tough. I don't consider that I know that there are bad trips for people, because they either had a pretty bad time, or they couldn't process what was going on. A lot of people feel this closeness to death, or death of ego, and a lot of people also lost sense. That is horrible for sure. That's sad, and that is unstructuring of ourselves. But if we are stuck in something, and we go through a hard experience with psychedelic, and we come out of the experience with insights, it might have been tough, but that might change the way we perceive it. So that might change the perspective of it being a bad trip. So for me, it's difficult to, in my experience, but I understand the experience of my patients is different, to say that some experiences have been bad. I have always come from experiences in a way where I've learned. I consider challenges as an opportunity to grow. So for me, that is just as important. That takes away the bad trip, the name bad trip. The preparation is very important. So to take care of your physical aspects, but also mental aspects, it's just very important for the outcome. Of course, the setting, researching very well into where you're going for the session and who is going to lead, that's just as important. Following the guidelines of the diet is found to be one of the elements that help a lot in reducing risks. And I would say that, to me, the preparation is essential for that. It's hard to say, because on one hand, I stress out that preparation is important, right? And that having a purpose, it guides the work and else. The thing is that how do we work with expectations in our own lives? Because expectations sometimes look like, I want this to happen. It's not about I'm open to see what happens, but rather I want to force things into happening the way in which I expect. So, as an example, someone said, I went with the purpose of feeling more. And this person was particularly not feeling very much. This person was very stuck on that. And when it went through the experience, started feeling anxious. And that person was saying, but now I feel anxious. And I said, but you asked to feel, right? And the person said, yes, but not this. So, sure, we don't go into psychedelics to feel worse, for sure. That's sure. But sometimes our expectations might be our own imposing of how we want things to be. And I would ask people if this is the way in which they function in their lives. Because expectations can also get in the way of the elements that come up with during the session. So maybe I said I want to feel more, and then I begin feeling more during the session, but I'm scared about those feelings, and then I retreat and say, no, but I didn't want to feel that. But these feelings are informing my life. And I can have expectations since the purpose is a bit having expectations. But expectations should be managed to understand that plants don't do what we say. And actually, the relationship that we establish with plants takes time, so that we know how to work with plants and then approach a different way in which working with them. But at the beginning, we're just getting where the plant goes. So we can't force the plants to do as we want, to do as we say. Rather, how about those expectations as a purpose could be something that will guide our session, but will also help us remain open to things that we might have not been prepared to or expected to find, yet they open other opportunities for us to grow.